Hi, everybody. This is Cecily, and I'm coming to you today to ask for your help. As of January 1st, 2012, Medicare reimbursement to physicians will be cut by 27.4%. I'm asking you to contact your legislators to ask them to put a stop to this cut. If this cut happens, it will have a major impact on not only Medicare, but on our healthcare system as a whole. The Sustainable Growth Rate Formula, or SGR, was implemented as a way to control the growing costs of the Medicare program due to the extended life expectancy of its beneficiaries and the number of baby boomers who are now reaching the age of retirement. As a part of this formula, the cost to the Medicare beneficiaries would moderately increase. However, the reimbursement paid to the providers for providing health care to these beneficiaries would decrease. So what does an approximate 30% cut in reimbursement really mean? Well, for one, many physicians will stop accepting Medicare, TRICARE, and Medicaid patients in their practice. You may ask why I mentioned TRICARE and Medicaid. Any changes to Medicare reimbursement impacts these insurance plans as well. The impact on TRICARE is major because this is the insurance plan that provides coverage to our military personnel and their dependents. Two, because fewer physicians will be taking Medicare, TRICARE, and Medicaid, patients will have to wait longer for appointments, thus possibly becoming sicker as they wait for care. The sicker the patient, the more costly it is to treat them. Three, many of the private insurance companies base their reimbursement rates on the Medicare reimbursement rate. Thus, the Blue Cross Blue Shield, United Healthcare, Pacific Care, Cigna, Aetna, all of these plans will also reduce what they pay providers. However, they will not reduce the premiums that they require you to pay for their coverage. Four, many providers who will continue to accept Medicare, TRICARE, and Medicaid will look to other areas to make up for the loss of reimbursement. Some of the things they will do will be to lay off staff, thus impacting our already burdened unemployment rolls. Their staff members will go without raises or other benefits. They will reduce the number of hours that their practices are open for business, thus reducing payroll and reducing overhead. They will reduce the amount of time that each provider can spend with each patient. So basically, if you can't spit out what's wrong with you in 10 minutes, it might not be addressed. And lastly, they may reduce the number of diagnostic tests performed. If they know they're not going to get paid for the test, they're not going to perform the test, which means that something that may be wrong with you may be missed. The charge to examine and develop this plan for repeal and recalculation of the SGR was given to the super committee, but we know they failed miserably in this task. Their failure not only ensured the 27.4% reduction for 2012, but also cleared the path for an additional 37% reduction in 2014. There is legislation in the House that includes a provision to avert the cut that may come to a vote as early as Tuesday. However, the larger bill contains other controversial provisions that put this in jeopardy. Again, I plead for your help. I'm asking that you contact your congressional delegates and ask them to support the temporary halt and ultimately repeal the SGR. In the past, many in the Senate and the House of Representatives have been willing to work to halt or repeal the SGR. However, in this election year, they are using your health as a pawn in their attempt to gain control. Many are hoping that it will fail so that they can blame the other party in the hopes of getting your vote. Let the leaders in Washington know that your health is not to be played with. If you need further information or would like to request a copy of the form letter, talking points, or even the draft legislation, feel free to contact me at the email address on the screen. I will gladly send this information to you. Thank you for your time and have a very Merry Christmas.